We know that long COVID is a real serious and debilitating condition that many people are suffering from, and I'd previously raised this with you, the possibility of amending the Occupational Injury and Illness Scheme or public sector pay, and you told me at that point that you were aware of the situation and that it was under active review. And I was wondering if there was any update in relation to this, or if there was an estimation in terms of cost range for doing this.
Thank you, Laska and Corla. Thank you, Deputy, for your question. The position in relation to COVID-19 absences in the public service has not changed since the Deputy's last question, which was answered in January of this year. At the onset of the COVID-19 pandemic, it was decided that special leave with pay would be used for self-isolation or a diagnosis of COVID-19 for public service employees to assist with the prevention of the onward spread of COVID in the workplace. The arrangements relating to special leave with pay are reviewed and monitored by my department on an ongoing basis, taking into account the evolving circumstances and public health advice. My government has agreed Ireland's plan for the next and final phase of our response to COVID and published its COVID-19 Reframing the Challenge, Continuing Our Recovery and Reconnecting Plan on the 31st of August. Subject to the continued progress we have seen as a result of the vaccination programme and all of our efforts in preventing the spread of COVID, we will enter a final phase on the 22nd of October. This phase will see the majority of restrictions lifted and replaced by guidance and advice to enable us to work together to protect ourselves and to live our lives to the fullest extent possible. We've provided support for our public service employees, including our frontline workforce, through the provision of special leave with pay for COVID-19. The current arrangements, like all other COVID-19 related policies and regulations, will be reviewed and will be subject to amendment as we see the continued benefits of the vaccination programme as we enter the next and final phase of the pandemic. My officials are keeping all COVID-related working arrangements for public service employees under regular review. While special leave with pay is available for self-isolation and where someone has been diagnosed with COVID for certain time periods, public service employees may access the Public Service Sick Leave Scheme thereafter. The scheme provides for the payment of the following to staff during periods of absence from work due to illness or injury, and the remainder of that can be put on the record.
I think I've been contacted by a number of young women who have been affected and deeply impacted by long COVID, and I just want to recount one story of a woman called Karen who had contacted me. She's 36 years of age. She's a frontline worker who tested positive on the 31st of December. She was admitted to the Mater Hospital on the 8th of January and had to be put on an oxygen machine because she has double pneumonia. And although she recovered from COVID in April, she was referred to the respiratory post-COVID clinic where she saw a range of consultants. They can be equally difficult for those who are, there are also people who have contacted me who don't work in the public sector, but she returned to work in late April. She relapsed 7 weeks afterwards and was forced to go on sick leave where she remained. She suffers from headache, chronic fatigue, dizziness, bad brain fog, breathlessness, high heart rate, palpitations, no energies, and she's always tired as a result of long COVID, and we need to have action for people like Karen.
Thank you very much, Deputy, and that sounds like a very difficult case, and my thoughts are with that lady. And maybe it would be helpful if I just put on the record what the arrangements are for special leave with pay in the context of COVID. So where an employee had been in the work premises outside of home during the 14 days prior to contacting COVID, special leave with pay may be paid, including for long COVID where necessary and for as long as needed. Where an employee has not been in the work premises in the 14 days prior to contracting COVID, special leave with pay may continue for up to 28 days. If an employee is still unwell after 28 days, they will move to ordinary sick leave arrangements, and you'll be familiar with the details of the ordinary sick leave arrangements, which I think are pretty good in general terms across the public sector, Deputy, but all of this will be kept under review. So in the case of long COVID, there is provision there in certain cases for the special leave with pay to continue, and if that doesn't apply in any individual case, then the normal public service sick leave scheme will kick in and apply.
Told me that she's on a number of new drugs that are used to address long COVID, and this costs over €100 a month. and neither of these are covered by the drug payment scheme. And for people who are out of work and cannot afford such drugs, this really is crippling. And there can be equally difficult for those in receipt of sick pay who are likely to have other outgoings like mortgages, like rents, etc. And I know you're not the Minister for Health, but you are the Minister for Public Expenditure and Reform, and the power of the purse does lie with you. And, you know, with these people who are suffering from long COVID. Now, this is one woman who works in the public sector and worked on the front line, but I have had, as I said, a number of young women come to me in relation to this who have been out of work. They may have been in their relationship, they may have earned, you know, been the main breadwinner, and they're now really, really struggling. So it's an issue that I think we're going to see rise more and more, and I think it's something that we really need to tackle now.
Deputy, long COVID is very serious, and it is a condition that the government takes very seriously. We acknowledge how debilitating it can be for individuals in different circumstances, and I think the truth is that we are learning more and more about it with each passing day. In certain cases, as I have outlined, the special leave with pay does apply for employees who suffer from long COVID. The particular context is where they had been in the work premises in the 14-day period prior to contracting COVID-19. So there is a demonstrable possible link between the contraction of COVID in that case and their attendance at their workplace, and in that scenario the special leave with pay can continue for as long as necessary. So I don't know if that applies in the particular case you're referring to. If it doesn't apply, then the normal public service sick leave scheme kicks in, and there are certain provisions there for how many days in a 1-year period and over a rolling 4-year period and so on that people can be out sick and continue to be paid in full. If you want to send me the details of the particular case, I will happily look at it and take it up with the relevant minister.
Thank you, Minister. Moving on to the